and welcome to this week's Medicare EmPower Hour. This is Erin Ackenheil. I own Black Point Insurance, where we help Medicare beneficiaries learn about the A, B, C's, and D's of Medicare, and we help agents and brokers nationwide learn to launch, grow, and retain their businesses. Through Medicare's EmPower Hour, we provide training, we bring in guest speakers, subject matter experts across everything Medicare to help you grow your business in a compliant manner and really knock your goals out of the park. We have a very important subject matter expert on today. We are all concerned about new regulations with CMS for 2022 open enrollment and 2023 enrollment and beyond. A lot of it centers around call recording requirements and some disclaimer language that was released in the marketing guidelines for this year, all to be implemented on October 1st for enrollments that will be effective January 1st of 2023 and later. Very, very important topic, and I'm excited to bring an outstanding guest on board you today. I know a lot of you are watching live, and I want to welcome my guest. She is the owner of Segal Medicare Experts. She is a breadth and depth of information with a long history of compliance, regulations, and everything Medicare for all different departments, marketing, sales, compliance. She is consulting with the major carriers and has a long, deep history and background in the Medicare space, and really is known as an expert in the Medicare space and helping us getting ready for open enrollment and beyond. So I am just so excited, everyone, to present and welcome Shelley Segal. So welcome, Shelley.
Thank you. Welcome. I appreciate the opportunity to talk to everyone.
We so appreciate you making the time. We know you're busy. You were just telling me recently you're filing scripts and regulations, just everything getting set up for AEP for major carriers. We feel so blessed to have you as our guest to help educate us. Shelley, we're live today. And so what will happen is people have the opportunity to say hello to us via Facebook or LinkedIn or YouTube. So if you're out there, please throw us a comment, throw us a like, make sure we know you're there. There's also an opportunity, everyone, to be able to ask live questions through the StreamYard app. So we're going through StreamYard, but we're on Facebook, we're on LinkedIn, we're on YouTube. So if you want to do a comment, ask a question, it's a great opportunity to take advantage of Shelley's expertise. We're getting some hellos. So Shelley, we are live, proof positive. We've got proof of life out there. And so I just want to jump in. What Shelley's going to do, everybody, is she's going to be sharing her screen with a presentation that she's prepared, because the regulations are so detailed and specific that we want to make sure that we're really, really getting the right information, but it's going to be interactive. I'm going to be asking questions of Shelley throughout, and you can ask questions as well, and I'll be sure to relay them to her. So Shelley, let me tee you up on your presentation, and you can jump in and get started.
Great, thank you. It's, as I said, great to be here, and I like to have a presentation so everybody can see it in black and white. Definitely take questions in between, because this is a lot to cover. I only really have 5 slides, just so you have the basic Reader's Digest, because I like to have Reader's Digest so everybody has the nuts and bolts. So without further ado, we'll go through this, and again, any questions before or after or during would be great. Just a little bit about Segal Medicare Experts. We're a firm that works with FMOs. We work with brokers, agents. We work with health plans. We work with call centers. Anything to do with Medicare Advantage and Part D, we do it. And here's just for a quick view of some of our projects, whether it's FDR compliance or executive coaching. We do a lot of audits and marketing material review and submission. We submit third-party marketing for a lot of different entities. So to start with, it's kind of like now moving into Big Brother watching you. CMS has had the intent that, because they only hear the bad stuff, just like when anybody's in a relationship, you know, you get everybody saying, oh my God, we had a fight, and hardly ever shares the good things. So CMS hears beneficiaries complain, and they're like, okay, now we want to hear to ourselves really what's happening, because we all know when beneficiaries say, wasn't told this, was told this, it's kind of he said, she said, And a lot of times I know getting to the age I am after all these years, I can't remember what I had for breakfast yesterday. So this is CMS wanting to have a reporting so that they can test it and see how great the brokers and agents are really going through the benefits and helping out beneficiaries, because that's what it's all about. It's helping the beneficiaries get the best benefits for themselves. And so this is effective, I say October 1st, 2022, which is not far away, because it's effective for any enrollment January 1st, 23. So yes, AEP opens up on 10/15, but on 10/1, essentially if you're enrolling an agent, somebody who's just aging in, you can enroll them for effective date of 1/1, hence the new regulations apply. So that's why I say it's effective 10/1, but in reality, the applicable is starting 1/1/23. So mostly that will impact all your enrollments from AEP starting 10/15. So this is a novel approach and kind of a chart to bottom line say that CMS has a new definition of what a TPMO is, third-party marketing organization. And really what it is everything. It's brokers, it's agents, it's FMOs. It is anybody who is involved to perform lead generation, marketing, sales, enrollment. So if you look at the chart, the top of the string is a sponsor, let's say like SCAN Health Plan. And underneath that would be an FMO that is contract with SCAN. And under the FMO usually has a downstream brokers and agents. Now let's say a broker or agent hires sales representatives or a call center to help generate leads. So essentially, SCAN Health Plan is now responsible for whatever the FMO does, what the broker and agents do, what the call center does, what sales representative, every single row. Of course, the buck stops with SCAN Health Plan or any other health plan that delegates it out to. Of course, this does not apply to internal sales reps for a health plan. It's only for third party, so somebody that has a contract. So what does the oversight have? And again, these are straight from the horse's mouth. These are the regulations. Cut and paste into the slide so you have exactly what CMS says. And usually regulations are a little hard to understand or take 3 times reading, but these I think are pretty simple. So plans have to implement the oversight of the following 4 things. They have to essentially be responsible for anybody that is contracted or that the third-party marketing organization contracts. And they have to enhance their contracts to include the requirements. 4 requirements. The 4 requirements are they have to disclose, third-party marketing organization have to disclose to their sponsor any subcontracted relationship. You got to tell the health plan who are they responsible for. And then 2, and this is the one that most people have heard and have questions about, is you have to record all calls with beneficiaries in the entirety, including the enrollment process. So in the past, it's been if you enrolled somebody on the phone or you took a scope of appointment on the phone, those had to be recorded. Well, that didn't give CMS enough of recording, so now they want to hear from the beginning, the enrollment process, what gets explained to the beneficiary, and the enrollment. So they kind of want to watch the movie with a beginning, a middle, and an end. So they understand what's being said and how great the explanations are and the questions that beneficiaries have. The other 2 are requirements are to report any kind of disciplinary action or violations to the plan. And there's a disclaimer that is required. And we'll go over that disclaimer in a second. Here's just a quick, the regulations are one thing, but the next thing is your to-do list. So really simple. It's important for everybody to create the policies and procedures so everyone understands like a call script or a talking point of of what needs to be said. It's great when it's in black and white. It's also important that know that it's responsibility of the organization to understand who is obtaining leads and enrollment. So plans and their FDRs are required to have that information in the contract. So it's great if we all work together, like in the ICE industry collaboration effort. There's a one-stop shop with medical groups and health plans and FMOs to work on the language so that we have one-stop shop where everybody's using the same language. Because essentially, again, the sales calls have to be recorded, and the third-party marketing organizations have to tell the plans if there's any disciplinary action and any kind of violations. So it would be great if we all get together and collaborate and put it together so it's a one-stop shop and we have the same scripts. As Erin, you said earlier, we were discussing this. It'd be nice if we were all using the same thing so beneficiaries get the benefit of everybody. So what is the disclaimer? There is this disclaimer, and we know it before, which any kind of, it requires that the third-party marketing organizations use this disclaimer on all materials and verbally, electronically as well, which is basically saying we don't offer every plan available in your area. Any information we provide is limited to those plans, and if you want more information, call 1-800, because obviously they have all the answers sometimes. So it has to be conveyed to the beneficiary within the first minute of the sales call. So what if, you do represent every single plan, then you don't really have to say it. But it's really hard that everybody is representing. So when you do not, you verbally have to say this disclaimer. You also, if you're communicating electronically with the beneficiary through email, online chat, it has to be that disclaimer on the information. It has to be displayed on websites. And also any marketing material. Print material should always have this as a disclaimer. There's also a disclosure. Disclaimers, disclosures, regulations, so much fun. So the disclosure is that when you're conducting lead generating activities, either directly or indirectly, you have to disclose to the beneficiary or their delegated, their power of attorney, that any information you're giving when you're collecting leads, that it will be provided to a licensed agent for future contact. It's kind of like at sales, when you market sales events, you always have to say, agents will be present. So now they're just making it a step further and saying, you have to let the beneficiary know that when you're collecting it, that when you verbally communicate, when you communicate in writing, when it's electronically, you always have to disclose to the beneficiary that they could be transferred. So you can transfer to a live agent who will enroll them in the new plan, or also that if you're taking a lead, that you need to disclose that we're going to go ahead and provide this information to the best agents to go ahead and provide you the most detailed information to help you make the best decision. I kind of added to it, but that's essentially
the way you say it, Shelley, sounds a little better. I just wanted to pause you there for a second just to ask a couple of questions about this. So when a person calls, so say they're calling and you have a helper who's answering phones for you, maybe you're an independent agent and you have somebody who takes phone calls for you, is this whole conversation with this preliminary agent has to be recorded. The disclaimer needs to be said. And then on that phone call, they'd say, I'm booking an appointment with a licensed agent, or I'm transferring you to a licensed agent. So just, can you take us through that example and show us all the touch points that the phone agent would need to take on that?
Sure. If you're answering the phone and basically just taking a lead, essentially that helper would simply say, I'm going to take your information and then I can now transfer you to a live agent, or I can just take the information and we can schedule something. Which would you prefer? So you're basically taking the disclaimer or disclosure and putting it into your conversation.
Absolutely.
And if you're emailing someone with, we'd like to know if you're interested in this, and essentially when you give us information, we can definitely transfer you to someone who is an expert licensed agent to help you with the next steps. So that has to happen all through the way. Did that answer that, Erin?
It really does. And I like the way, Shelley, you're so consultative, because it feels so rigid and like this is going to be an awkward experience, but you're putting it into comfortable words. So it's, yes, the disclaimer is being said, but you're saying it in a way that is relatable and conversational and still makes this process go really smoothly. So I think that's really, really helpful for everyone to hear. So thank you for that.
Yeah. So I think the worst thing is the good, the bad, and the ugly. The worst thing to say, okay, the government needs me to disclose this, so please listen to the following statement.
Right.
Exactly. Just make a conversation is the best way to go.
Perfect.
And so that basically is everything in the nitty gritty. So it's important to have knowledge is having the right answer, but intelligence is asking the right question. And so essentially, we always say there's no such thing as a dumb question except for that one not asked. The more questions that we get, the easier it is to help understand exactly what has to happen.
So, Shelley, this has been great. So thank you. Just awesome presentation and great overview of what's going on. I want to invite people on the line to ask questions live. Shelley, we do have some that have been pre-submitted. So I have a list here of questions that have come up. One of the questions was, what about for face-to-face one-on-one appointments? Is anything special going to be required on face-to-face appointments?
No, at this point, and hopefully nobody goes that step further, this is only for the phone. And the intent is, if you think about it, is CMS wants to have the opportunity to know more. It's kind of like their focus group. So they just want an insight to what's happening, and they're choosing to do it on the phone. So one-on-ones, and now everybody's going to be doing one-on-ones instead of enrolling on the phone. There are no changes in the recording. It's just for phone calls.
Got it. But if people are calling in and scheduling the appointment, that telephone activity would need to be recorded. Is that clarifying? Is that, so if I'm, for example, if I'm going to have a one-on-one appointment with you, Shelley, in your home to help you consult, but you probably called me to schedule that type of thing. So that initial phone call would need to be recorded, just to be clear for everyone?
Not necessarily. If I'm getting a phone call and it's Erin, and she says, I'm interested in information and can you come out to my house and talk to me? That does not need to be recorded. But when it starts in the enrollment process or the sales process, is I'd like to know more. And Erin, I heard you're an expert. You can tell me the best plan for me. So let's discuss that. That's when you start the recording and say, okay, so let me help you with all this. And essentially, I don't have all plans, but I'm going to give you the best information I have so that you get the benefit. All that would be recorded, including if you do the enrollment form on the phone, enroll by on the phone call, or but if you're sending them to an online, then that part would not have to be recorded.
Got it.
Or if you're sending the enrollment form and you're saying basically I'm going to mail you the enrollment form to complete and mail back, then the call is over at the end of that.
Got it. That's very good advice. So a question came up. I actually got it. It came again, and it was also a question that came up on the pre-questionnaire. Good information. What about Zoom? So what about Zoom calls? What about people who are using Google Meet? It's almost like a face-to-face, right? We're sharing screens. We're seeing each other. We're helping with enrollment. What are going to be the requirements in that space?
So CMS at this point is saying just the telephone. So it's on the telephone. They have not said if it's through a webinar. So at this point, it's just when somebody is talking to you on the phone.
Fantastic. Okay, so good question, and I'm sure good feedback for a lot of people who converted to online face-to-face over pandemic and so forth. So kind of a new way of doing business. So we had another question come up online. What, if anything, has caused CMS to require these new rules?
That's a great question. If you think about it, there have always been a lot of complaints. You're going to always, getting in this business, 30 years ago, I was enrolling back in FHP days in Southern California for 2 years, telemarketing and using my green bar to call beneficiaries and enroll. From then, CMS has always received complaints on the 1-800 line. And it's not like everybody calls and say, hey, I just want to tell you, I talked to Erin. She gave me the best information. I can't believe this is true.
I can't believe all my compliments have not been coming through, right?
Yeah. Instead, what they get is a complaint line, the same thing as the grievance department gets at essentially a house plan. It's always you hear the bad stuff. And so, first they actually did send CMS out, representatives out to meetings, and did some information gathering, but then that didn't last. And so they're just trying ways to find out, is there something they can be doing better to help the word get out in a clear fashion so all these complaints don't happen. But the truth of the matter is, you're always in this population, as I started to say back in 30 years ago, is essentially in this population, you're going to get people confused. And so there's always going to be people calling in and saying, I wasn't told that my drug is not on this plan, so I need to disenroll. And that's all CMS heard. So they want another clue to what's happening. And They need to remember that essentially this population, there are going to be a lot of questions and a lot of issues. And it just happens. It's just part of the business.
Right. So, Shelley, we had another question pre-submitted here, so I'm checking my list. Do seminar RSVP, during open enrollment, a lot of agents conduct community seminars, this type of thing. And so people often call in to RSVP for those events to participate. Do RSVPs need to be recorded in this new world?
No, RSVPs do not need to be recorded. Great question. It's just the chain of the enrollment process. Whatever leads up to on the phone getting to the enrollment, the way CMS thinks about it is they've done enrollments over the phone, so they've heard those phone calls. They want to hear what happens before that call.
Gotcha. All right, so we just had a question submitted in here. It says, do we think, it's really a philosophical question more so, do we think that, I can't even talk, Shelley, will the rules cut down on the calls seniors are getting throughout the year, trying to switch them and all these aggressive marketing tactics we see from some of these big entities? What's your theory on that?
I don't know if this will change that behavior. Although, those calls, again, should be anything related to sales, be recorded, but I think it'd take a while before that changes any kind of behavior like that.
Yeah, I think so too. Optimistically, that's what I think a lot of these regulations are about, right? Is some of these big centers that aren't necessarily working one-on-one with a beneficiary in their community, and it's really not going to stop any of that, I think, at this point, but I think it's baby steps maybe towards that. So hopefully it'll have some good. So that always brings me to the question people keep asking me, and I think a lot of partners and brokers have been kind of in denial since the marketing regs came out and they took their AHIP. It's like, is this really going to happen? And so my question to you as an expert, you've got the in, right, with CMS and knowing your contacts there. Do you think there's any chance that implementation will be delayed? I know NAHU, which is the broker association, has been writing and trying to get some reconsideration on that. Do you think there's any chance that this could be delayed, or are we full guns blazing for October 1st?
From what I hear, senior management at CMS is saying we're not delaying. This is something we've been working on And essentially, everybody has already had to record the SOA on the phone, scope of appointment. Everybody had to do the enrollment over the phone and record it. This is just one step further so we can help understand the discussion and see what's happening with the discussion and how we can make things easier. So sorry, the simple answer is I don't think it's delayed.
Gotcha.
We can hope and pray and put in our 3 magic wishes. But at this point, I know there's been a lot of lobbyists and letters to the senior management at CMS. And at this point, I don't hear any rumblings about a delay.
Yeah. Well, thank you for sharing that feedback, because I do think that a lot of agents, even myself included, maybe for the early summer months, just a little low-level denial as we're going and getting into this process. But the reality is hitting. And so when I talk to agents every day, everybody's concerned, like, how are we going to implement this? What do we do? What's your vibe on the street, Shelley? What you're hearing from different partners? What's the solution that you're hearing being offered to agents? What might work for people listening to get ready to comply with all of this?
So great question. I know that some people use Sunfire, and they are putting together a way to have the disclosure in the scope of appointment and also to record calls. Also, there are some phone apps that you can use on your iPhone or Android. So like my Samsung, if you're calling out, you can essentially use, there's one called Ring Central that will record the call, and it works on both iPhones and Android phones. There's also Tape a Call, which will record the whole call as well. And the steps then need to be processed outlined by all the Medicare Advantage plans. Like, once those calls get recorded, how do they get to the health plans? Because the health plans essentially are supposed to retain those, and everybody's supposed to retain them for 10 years. So who has that storage and how does it get done? Those are questions that we all need to work on. I don't have those answers.
Right. Well, and Shelley and I talked a little bit just earlier for everybody listening, just how the industry really needs to collaborate on good solutions for this. I will say, as most of you know, I own Black Point Insurance, which is a managing general agency, and I work under the Van Berg umbrella. At Van Berg, they offer agents a tool called Sunfire, which Shelley alluded to that earlier. And Sunfire is developing the technology to handle this. So they already store scopes of appointments and enrollments for 10 years. They'll be able to store these phone calls from end to end that we need also for 10 years. So it's an app that can associate with our phone, or they can assign us a special phone number. So I'm going to be one of the testers on that. So I'm very excited. And just so you know, this might be a good time to work with an upline partner that has a relationship with someone like Sunfire to help be a guide for you and help support you in this. There's also avenues that you can go directly on your own to explore and see what the costs are and so forth, like the Ring Central and some of these other tools that you can attach to your phone. It's coming. So if you need help and guidance, I'm here. I'm Erin. I can help you with that. Whether you're working with me or not, I can help you figure it out. And if you are working with me, rest assured we've got the solution coming for you, rolled right into that Sunfire tool. So we're working on it. I'm going to be a tester. And of course, I'm going to put my stamp on hoping to make that as easy and smooth as possible. So, and I don't think it's just me, right, Shelley? Everybody's going to be drawing for a solution to this and wanting to provide agents with tools, because nobody's going to want us to stop providing the support and selling, these products to seniors out there.
Right. And everybody's working on it. We've gotten several requests for call scripts so that all the agents are saying the same thing. Since the call is being recorded, you want to make sure they understand the disclaimers, and it needs to be recorded when they're on the phone. So, it'd be great if there's no reason to have 20 different call scripts. Let's all collaborate and have one call script so that we can use it, or talking points. The same thing with contract language or attestation language for everybody. Instead of being hit by 26 different health plans of these are the new requirements and these are the new contract changes, we should all just work together so there's contract language and attestation language, so it's all the same.
Right. So you heard it here. Carriers, FMOs, leaders, contact Segal Medicare Experts and help. Shelley can help us coordinate all this across
Oops. I think you froze. So essentially, we can help with writing scripts or going ahead with talking points, or also doing training, any kind of training that needs to happen. And let's see if Erin comes back. And essentially, if anybody has questions, you can send them to me as well. I'd be happy to answer, and we'll have my phone number listed in the follow-up. So, but it's 562-334-7980. And then also, you can also email me at Shelley Segal at smeteam.org, SMETEAM, and I'd be happy to answer any questions to essentially help any way we can. So I know there was another question. Let's see.
So I had one here, Shelley, just, you know, in terms of detail, basically some questions about the different call center recording entities that you talked about for people to work on their cell phone. Do you know if those services have storage capability as well?
They do have storage. So that would definitely help. But everybody has different storage abilities or requirements. So definitely you need to go ahead.
Absolutely. And now another question came through here, Shelley. Will there be heightened penalties for agents and brokers who do not comply with call recordings?
That is a great question. And that would come from the health plans in their contracts if they wanted to do that. I have not heard of any health plans that have been working on providing penalties. But I would think because now the health plan is responsible for that whole chain of enrollment from the FMO down to a call center, that there will be some additional contract language that has the performance guarantees.
I think so too. And eventually, because health plans need to store the information, I'm thinking that we're going to get audited and have to be able to produce the calls by, you know, for certain beneficiaries, especially if a complaint comes through. That'll be the type of proof that we'd have to provide in the form of an allegation. That type of thing, I can see that impacting all of us.
Right. And so, CMS has done a couple audits this year to health plans, asking them for 10 or 5 or 10 beneficiaries who enrolled over the phone, has asked for that enrollment online, a copy of that recording. So that's starting as well.
It's already starting. So we can expect that that's going to be extended to third parties, including individual agents and brokers for sure.
Absolutely.
So Shelley, you're incredible. Wealth and just a depth of all knowledge, everything Medicare, and just I really love your style because you figure out how to help us in a way that's still manageable, that doesn't feel robotic and like we're being punished, right? We're as an industry, we're here to protect Medicare beneficiaries, to do right by them, and all of this, for better or for worse, as much as it's stressful for us to experience changes, it really is putting the beneficiary at the center of everything we do and providing a good experience and making sure they're at the right plan at the right time. So Shelley, I know that you provide consulting services, and I just thought if people wanted to get in touch with you or get a consult on scripts or guidance or questions, what's the best way for them to get in touch with you?
Yep, absolutely. You could call me by email. Call me by my phone. It's 562-334-7980, or email me at shelleysegal@smeteam.org. We have a team here ready to help in any way we may.
Shelley, you're incredible. Thank you so much for joining today. You're a fantastic guest. You're so prepared, and you've got us all lined up. For everybody out there that is feeling stressed, you can call me. I will help you, guide you through the process. And if it's beyond me, we'll get Shelley involved in terms of scripting and helping us get guidance and really just being collaborative across the board as an industry. because that's what we're trying to do, right? Provide the best experience and to do right by all of the seniors out there that we're helping. So Shelley, thank you so much. Segal
Thank you for the
Medicare
opportunity.
Yes, of course. And just want to encourage everybody to engage with you, especially provider groups, carriers, large FMOs. Shelley and her team are there to be a resource, to join us all together and be collaborative. And that's the way we should be approaching this, not so fragmented. We really have to collaborate on this. So Shelley, thanks again. Have a fantastic day.
Take care.